comes to examining a joint, one of the things I want to pay significant attention to is whether or not there is any heat along with the swelling or pain to that joint. The reason being is, with a lot of medicine, we're not necessarily trying to diagnose a problem as much as we are exclude an alternative one. So let's assume we've got a patient with a painful red swollen knee. Could be gout, it could be that they've banged it and we've got a bursitis going on there. It could be that they've got a rheumatoid problem and that the body has attacked the joint there. However, the thing that I need to know, or certainly try to rule out, is the evidence of a septic arthritis. Now, with regard to septic arthritis of the knee, it's going to be excruciatingly painful. The patient's not going to be able to weight bear on it, and they're going to feel very ill in themselves. They're going to feel septic, as patients will describe it. The probability is that they're going to be septic from a medical perspective. They've got the pain, they've got the swelling, they've got the erythema, so they're probably going to have a temperature, they're probably going to have an effect on their blood pressure, and their pulse rate is likely to be going up. So all of these things I've got on my radar to say, is this a septic arthritis joint? When it comes to actually examining the knee, it's going to be excruciatingly painful. Very similar to that which we'd see in gout, but we're going to have a complete loss of range of movement because it is so painful there. Again, with gout, we wouldn't expect to see those systematic issues. Now, very crucially, the way we're going to be able to tell the difference here is by getting a tap of the fluid, but that's definitely not something that we're going to do in GP land, because although the knee is swollen due to the fluid in there, that's something that we really want to get done in the hospital in a safe place where we can provide the IV antibiotics or potentially intra-articular antibiotics if we've confirmed we've got septic arthritis. And from a time perspective, it's not just about the sepsis in terms of the infection being a problem, but that joint is likely to be damaged by the infection, and the longer it's left, the greater the probability of significant damage to that joint.